Hari Om everyone. Welcome to our show of Sanskriti and Samskar. Today we are on the 23rd episode of our Sanskriti and Samskar series. And today we have a very interesting topic. Every time we have a lot of innovation happening on our show. Today we have a very hot topic called something related to orthopedics. Now, knee replacement. Every household is talking about knee replacement after the age of 60, 65, or maybe 70. So this topic is based on that. The name of the topic is today non-surgical uh, orthopedics. So without surgery, how you can, get without surgery you can get things done. So first of all, I'd like to welcome. So it is basically a regenerative procedure. So I'd like to invite Dr. Sanjay Dahiya, please, on the show.
Yeah, Namaskar and Hari Om to all.
Namaskar, Hari Om. Welcome, Dr. Sanjay, to our show.
you.
Very warm welcome. I will introduce Dr. Dahiya to our viewers today. Dr. Dahiya is an orthopedic surgeon holding an MS degree in orthopedic. He has 30 plus years of experience in serving people when he was working with the government. Now he's retired as a director health. He here is on our show is with a very innovative technique of preventing joint replacement and relieving pain by orthobiologics. Welcome, Dr. Sanjay Dahiya, to our show.
Thank you, sir, once again.
Thank you. Now I'd like to invite our co-panelist and co-host. Her name is Srimati Meenu Melwani. Welcome, Srimati Meenu Melwani. Welcome to our show. Hari Om.
Thank you.
I will quickly introduce Srimati Meenu Melwani. She is president of Hong Kong Indian Women's Club, and they are doing a lot of charity around under this belt. And she's also co-founder of Kanyadan charity, which is where they help getting poor girls getting married. And she started this venture along with Dada George Harilila. Srimati Milwani is one of the most distinguished, graceful, and compassionate personality. She is not only a social icon, but she is symbol of inspiration for people of Hong Kong and whoever she comes across with. Welcome, Meenu Melwani. Welcome to our show.
Thank you. I must correct. I was the president, not anymore now.
I'm so sorry.
Okay. I was. Yeah.
Great. But once a president, always you're a past president, maybe.
Yes.
Great. Thank you for clarifying. Sure. Now I would invite Sir Dada Dayal and Harjani sir, as we happily know him as Dadu Zen. Dadu Zen, please welcome and grace our show, Dada.
Jai Shri Krishna, Jai Shri Ram. Dr. Ji, aapko pranam. Warm welcome to our show.
Thank you so much, sir.
And I'm very excited to listen to your wonderful information that you want to give. And I would like to welcome my elder sister, Di Meenu, on our show for the first time. She has graced us. Thank you, Di Meenu. Welcome to our good show.
Dadu Zen. Thank you so much.
Today.
Okay, thank you so much. So may I start asking a question,
No,
Doctor?
I want to, before you ask, I normally have, I welcome everyone with a doha. But this time, instead of the traditional dohas, we shall take a slight deviation and touch a subject of great urgency. And if we all practice, then we can all reap immense good karma for ourselves. We are all sitting in front of a harsh reality of imminent water shortage on this planet. According to UNESCO, 26% of the world's population does not have safe drinking water. 46% lack access to safely managed sanitation. More than 2.3 billion experience water shortages for at least 1 month, and thereby posing a severe risk of livelihood and loss of life. So therefore, I found it very important to share this subject, and it is incumbent on all who watch this show to exercise self-restraint to avoid water insecurity, or what I would term as water bankruptcy, for governments and population in future. Because if we do not take care now, then it would be quite possible that our grandchildren will have to either beg for water or pay a heavy price for pure water. So here are a few suggestions to stop wastage of water on a daily basis. These are highly practical suggestions, and I think it's time that we all subject ourselves to these practices. First, do not treat your toilet as a trash can, because we waste 5 to 7 gallons per flush. So you can imagine how much water is being flushed out by this irrational way of doing every time we like to go and flush. Number two, do not take long baths and just stand under the shower like a tree and or like a robot. For 8 minutes of shower, we are consuming 17.2 gallons. So you can imagine how much water shortage is being conducted by just taking a bath and standing and doing nothing. The least we could do is that when we are putting soap on our body, we should stop the water from flowing. Flowing water is not so healthy or not so amenable for or conducive to this. Or the traditional balti bath, people in the olden days used to use a balti. That is actually practical. This shower thing is a lot of wastage. Then we have to check our shower heads to have replaced by high efficiency, low flow, and check all the leaky pipes in our homes. Because averagely, an household wastes 10,000 gallons of water annually just by these leaky pipes. So we have to be a little bit more alert and have our pipes rechecked. Next would be avoid laundry loads that are not full or half full, because you're wasting a lot of water. So only when it is full, you should use it. Otherwise, if you can wait, better wait. Then avoid running water while brushing your teeth. People brush your teeth and the water is running. How much water is being wasted per person every day? You can very well imagine. But the most biggest or sensitive aspect is the consumption of water in raising cattle. Just for your idea, with a little research done, it takes 1847 gallons of water to make 1 pound of beef. Can you imagine how much is that? How much water is being consumed? For making 1 pound of chicken, we need 518 gallons. And for 1 pound of pork, we use 718 gallons. To raise one goat, we have to have 5 to 7 liters of water a day. So without advocating a veggie diet, you have enough reasons to be the change that makes the change. So we all have to be very alert, because the greatest blessing that we can leave for our future generation is the inheritance. For every drop of water will one day become a river of life for our future generation. So with this introduction, I would like to now leave you guys to have a good interaction.
It's a very good idea, Dadu Zenda, what you've told us. As a housewife, I must say, I do check water. I do stop water while brushing the teeth. But this shower thing that you've told me, I think from tomorrow I should stop it, then use the
Lovely. I think you'll serve as a good inspiration and example for everyone.
And I'll put it on whatever WhatsApp groups I have. I'll definitely circulate the word. I'm sure many are watching you as well right now.
Thank you.
Thank you.
Go ahead and have a good interaction with the doctor. Hari Om.
Okay, so Hari Om. So doctor, I am going to ask you questions that I'm absolutely not aware of at all, okay? I would like to understand things. My first question to you is, what is regenerative orthopedic or orthobiologics?
Ma'am, as the term itself says, first of all, let me tell you, ma'am, I'll use very less scientific terms, more of common words so that we all can understand what I'm talking about. Regenerative orthopedics. The word itself says regenerative, regeneration in orthopedics. So, what we do in this is there are healing elements that are present in your own body. Every body can heal itself. Our motto in regenerative orthopedics is to that natural healing elements which are there in your body, they are extracted from your body, they are prepared and then injected in the area of the body that needs healing without any drug and surgery. So we don't do any surgery, we don't use any drugs. It's all your body part healing your body. That is regenerative orthopedics and also known as orthobiologics.
But would you not use some kind of something that, no pain, no nothing? Would you use something for that?
Ma'am, actually, they are all injected into the area where trauma has been there or which needs healing, like joint, muscle injuries, ligament injuries. So they are basically small needles which are used. Then also, like if somebody feels like, we do give local anesthesia to that very part of the skin just to inject the needle.
Okay.
And it is a pain-free procedure, ma'am.
And it just takes a day or two, just one day
Ma'am,
to
it's
do.
a daycare procedure, ma'am. It just takes 1.5 hours. The moment the patient enters our clinic, 1 hour is the processing time, and another half an hour is to move the patient to sterile OT
Recovery
and then
room.
inject it, ma'am.
Okay.
So walk in and walk
Sounds
out, ma'am.
sounds simple. I mean,
Yeah.
and at what age would you said 70 plus, is it? You do it to,
No, ma'am.
or
No,
only
ma'am.
the sports
It is
people?
any age, ma'am. Basically, I do of all the ages. Sports person, they come at very young age. They start coming at 12, 13, 14 years of age. Then the senior sports person, ma'am, usually come at 20 to 30 years of age. Like usually many of them suffer from meniscus tear, partial tear of ACL, knee joints. Remember, ligaments are there, partial tears are there. Then many suffer from tennis elbow. Who play tennis, few suffer from golfer's elbow. So all these
Yes.
are sports person. They come at a very young age. So
Okay.
then, madam, this is the only way to heal them so that they continue playing sports and they are not out of sports. Because once
True.
we go in for a surgical procedure, it really hinders
It
somehow.
hinders. Yeah.
Yeah.
Yeah. Okay. So wonderful. And
And
what
then,
is
ma'am,
GFC? What is GFC treatment?
ma'am, the full form of GSC is growth factor concentration.
What is,
Like I said,
sorry?
growth factor concentrate. Like I
Okay.
said, ma'am, we are doing a natural form of healing. We are taking out your healing factors. So, growth factors are one of those factors, like the word says, growth factor. Whenever a child gets injury, it heals. Usually, children they fall while playing. You see, after 3 4 days, there is a scab
Yeah.
formation, and then it
Naturally.
heals. Same occurs. You will see a child getting injury healing quicker than a
An
adult
adult.
who crosses 60 65. It is because the natural healing process or the natural growth factors which are present in the body of a child uh, have more potency than the natural healing factors which are present in an adult. So this is a very simple thing we say. It's a weighing scale, ma'am. There are two things: your body, your growth factors, the potency of your body growth factors, and the trauma you have in your body. Like I'll use, because the topic was started with osteoarthritis. Usually, osteoarthritis knee, it's a chronic degenerative process, ma'am. I'll just deviate a little and I'll tell you what osteoarthritis is, so that we understand the mechanism. What is this called osteoarthritis and what we do as an orthobiologics. Osteoarthritis is, ma'am, there is cartilage in every joint. So knee joint also has a cartilage. The thickness of cartilage is hardly 2 to 3 millimeter. The first time you have pain in your knee means already 30% of the cartilage is damaged. Then
Really?
we keep taking, ma'am, medicines, we keep taking gels, application local, hot fermentation, physiotherapy. Everything slows down the process, but it doesn't stop. It's a chronic degenerative. So ultimately, after all this thing, there was one procedure, total knee replacement. But with the invention of this orthobiologics, we come in between. We say no. Before that, we will try our body should heal our joint. So, ma'am, younger age, more potent
Easier.
factors, ma'am, less damage, more good result. So we say like osteoarthritis knees into 4 stages. So we say why you come in stage 1 and stage 2, we will heal you completely. If it is stage 3, your cartilage is less. Stage 4, nothing can be done. Then it is bone to bone,
Then what
grinding against
happens?
each other. It is bone to bone, grinding against each other. So, ma'am, you don't have any cartilage.
Yeah,
What will we stimulate and regrow?
that is too late then for that
Yeah,
patient,
it's
right?
too late, ma'am.
Yeah,
It's too
yeah,
late.
yeah. So now, is GFC and PRP same? And which is
Ma'am,
better?
earlier it used to be PRP. What the full form of PRP is? Platelet-rich plasma. As everybody knows, ma'am, we have red blood cells in our body. We have white blood cells. We have platelets. Every cell has different function. Out of this, the platelets are the healing cells. They are one who bind and make that clotting and the heal the damaged part. So, what earlier we used to do as an orthopedician, PRP is used in many other forms also, ma'am. Cosmetics also it is used for
Re-
many cosmetics use it, ma'am. Dental also it is being used, gynae also. But being an orthopedician, we are injecting into either muscles which are torn or injured, or we are injecting to the joints. So our concentration of platelet is 6 to 7 times what normally you have. So what we do is we take blood from you, we will process that blood, and after processing, we will separate the platelets from it, and a concentrated bullet form of platelets will be injected into the joint. They will go there, they will get activated, and they will ultimately release growth factors inside the joint. Those growth factors will regrow the joint, damaged part. So this was
But
PRP.
if I may ask, is this all accepted by FDA and whatever
Ma'am,
medical,
actually, it's a biological thing and it is your natural blood. So FDA controls only the
the
processing
medication?
instruments which are being used, ma'am. They are
Okay,
FDA approved, ma'am. Plus, no drugs we are using, ma'am. Nothing we are using outside. So, no injections, ma'am. So this is not getting regulated by that.
okay,
Yes,
okay.
stem cells are, because ma'am, stem cells are basically a universal donor is being used for that. But in this, we use your own blood. That is why we say it is very safe. The safest thing you have is what is already there in your body. It's circulating in your body.
Really amazing, amazing what you're telling us, really. And now my other question would be how GFC treatment works. How does it? I mean, you already told us, right? This is what the answer is, right?
Yeah, ma'am. So each platelet, actually, the difference between GFC and PRP, I'll tell you, ma'am. GFC is little advanced to PRP because I said we initially put a bullet form of platelets into your joint and they get activated there and release growth factors. Now, what we are doing is once we separate your platelets, we activate them outside only and we release growth factors out of them and we directly inject the growth factors. So, the first advantage is like after PRP, you may have little soreness, little pain for a day or two. In
Naturally,
this, that is
naturally.
not there, ma'am. Ma'am, in this GFC, it is not there, ma'am. It is completely
Okay,
pain free, and the results start coming early because already we have activated them.
amazing, amazing. So, say if I was to have it done, for example,
Yeah, ma'am.
one has to fly to Delhi to come to you, or do you have branches elsewhere, or
Uh,
what?
no, ma'am. I'm doing it single handedly. I'm
Just
running my
yourself.
own clinic. We are in Gurgaon, ma'am, and that's the only place we do it, ma'am.
Okay.
Yeah, there is one thing, like people do call me, like we've been to a place near Shimla. There was a university, they called us. So whoever calls me, I'm always there, available for them.
Okay.
I
So that's
even,
nice to know.
yeah, I even go and
Nice.
teach them because it's my passion, ma'am. I personally feel like sir was telling we have to save water. I personally feel even implants cost a lot of water.
Of
The
course.
processing and manufacturing implants takes a lot of water. So it's my passion, ma'am, actually.
Thank
I
you.
want to regrow. Like people have a passion to, regrow the planet. They do plantation. So my passion is why not to regrow the damaged parts of the body?
Very
And it
good.
is not
Very
only this, ma'am. I've been trying this, and I've done few very good other places where people don't know even. There was a pregnant girl. She had a very big wound over her thigh, an insect bite. She couldn't take any medicine, no drugs. I healed her wound with this. We didn't give her anything.
and there's no mark, nothing at all.
No, ma'am,
Oh,
not at all. The safest way,
really?
the best way. They were very happy. They never thought there is something like this.
Very nice. Lovely to know that. Really nice. So, I
Thank you, ma'am.
mean, there, Daduzen, anything else can I ask? So, say for example, I suffer from sciatica at the moment.
Yeah,
As
ma'am.
an orthopedic surgeon, what would you tell me? I have been told I can't have a surgery, too old for that.
Ma'am,
The injections of steroid don't work anymore, and medication, painkillers is the only way to live. Is there
ma'am.
any other way
Yeah,
apart
yeah,
from?
yeah, ma'am. Yes, yes. Why not? Why not, ma'am? Actually, what happens is there are two things I'll tell you. One is clinical examination. One is radiological examination. Now, what is happening in our branch is the moment you enter the clinic, you say, I'm having this and this pain. They will say, okay, get the MRI done, get the CT done, get the ultrasound done. No. When we used to study 35 years back, we used to clinically examine the patient and then see what the patient is telling factually what is happening. I don't have to treat an MRI. I have to treat a patient. So they are two separate things.
Wow.
There are many people who have pain. Your MRI will show disc prolapse. There are many people who have backache who don't have anything, but when you do their MRI, you will see disc prolapse there also. So that is something we should differ, ma'am. I differ on this. I say no. I'll examine a person clinically. I'll see a person clinically, then correlate it with radiology, and then do the treatment.
Thank you. So I think I'll have to make a visit to Delhi very soon.
Ma'am, whenever you are coming to India, you're most welcome, ma'am.
Sure.
And there are few nerve tonics which are very effective. There is a right type of physiotherapy which is very effective. It is a double-edged sword, ma'am. Physiotherapy done rightly is very good. Done wrongly,
Which
that is
one?
very
Which
bad.
one? Sorry. Acupuncture is
Physiotherapy, ma'am.
acupuncture.
Few exercises.
Physiotherapy.
No,
Yeah,
ma'am.
I go for physio,
Yeah,
of
yeah.
course.
And
Yeah.
that is what I said, ma'am. There are different exercises. Few are very good for you. Now we have to see which is beneficial for you. The one
Okay.
which is beneficial for you may not be beneficial for some other person.
Agreed. 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 Yeah. Agreed. Okay. Thank you so much. Thank you. That's a
Thank you,
great
ma'am.
help. So
Yeah.
now let's start. Vishal.
Sure. Hi. I'll take it
Hi,
over
how
from
are you?
here. Hi,
Yeah.
hi, sir. Sir, it was very insightful what you just now told us. I just wanted to ask, what are the side effects? Are there any side effects of this process by any
No,
chance?
not at all. No, 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 no. Because see, it is your blood, your natural healing factors which have been taken from your body. So it has got just no side effect at all.
Okay, great. Great.
Yeah, yeah, not at all.
And that's a good thing. And what are the key advantages of this treatment? You have mentioned almost all, but if you can
Yeah,
just
yeah.
pin down for viewers just some
Yeah, yeah,
pointers
sir,
like what are
sure.
the key pointers?
The first thing is, sir, it is a non-surgical procedure. We don't use surgery, we don't use blade, we don't use drugs. So very natural procedure. Then healing your own body with your own cells without any side effects. And daycare procedures are hardly 2 hours, 1.5 to 2 hours. You walk in and walk out.
Hmm.
So those are the advantages, sir, which we have.
Great. And age factor, what age factor you think we should consider for this treatment? Any upper limit like this age person can come or
Sir, it depends upon the age as well as the damage. Like I said earlier,
damage?
sir,
Okay.
your
Okay.
body is healing your tissue.
Hmm.
The less damage you have and the better growth factors you have in your body, better chances of healing.
Hmm.
If there is somebody who's an
Understood.
athlete and he's doing yoga and other athletic works, got a good biological age, it's not chronological age, we have to say in this. So even if
Yeah.
he's at 55 or 60, he may show better healing than a person who is having 5 years younger age than him.
Hmm. True, very true. And sir, under what conditions you recommend to get this treatment done? Any specific conditions or
Sir,
like
yeah, we have different conditions, sir. Like commonly, as the topic started with osteoarthritis knee, we recommend the earlier you come, the better results are.
right?
Grade 1 and grade 2 osteoarthritis, we have very good results. So one is osteoarthritis knee, sir. Then let us start from head to toe, sir. One is periarthritis shoulder, जिसको frozen shoulder कहते हैं, sir.
Gee.
I mean to say, sir, wherever people use steroid is a catabolic thing. It damages your joints ultimately.
Right.
This is the natural steroid which your body produces.
Steroids, no
Right.
good.
So we have fight and flight hormones in the body. You know, our body gives response to everything. So
Yes.
our body itself produces steroid when we are, when you have to run suddenly. When you see a tiger behind you, a lion behind you, your body will immediately pump out
Yes.
steroids.
Right.
Those are natural steroids. So
Hmm.
I actually call it a golden blood. It has got efficacy much more than steroid without any side effect. Plus, it has a regrowth potential. Now, different researches, different papers published in Western world, Japan, Korea, they all show injecting steroid, okay, once or twice in lifetime is okay, but don't cross that because the only thing it is doing, it is anti-inflammatory, but along with that, it is damaging your joint. Degeneration progresses. That has been what has been found in different researches.
I can believe that.
Great.
And what's the
sir,
cost like? Sorry for
ma'am.
interrupting.
I'm so sorry, ma'am. I just started from head to toe. I got deviated. So this I said. Then you come to elbow. You have both the joints, inside and outside. So we have golfer's elbow, tennis elbow, both. Then many people have this pain over here. This is known as de Quervain's disease. This is again a commonest place for osteoarthritis. This also we treat. Then carpal tunnel syndrome. This place. I just gave it to a lady 2 days back and she's 85% better. We don't operate. No need of surgery. So then you come to any ankle sprain. Then you have like runner's knee. Then you have degenerative meniscus injury, like anybody of 50 years. The MRI shows meniscus is injured. Research is so it has got a fabulous result if you inject it. Then partial tear of ACL, PCL, partial I said. It is being used and showing very good results. So these are the places, sir. Then, sir, we have, you must have heard, plantar fasciitis, pain in the heel.
Yes.
Also, it has got a very good effect. I have my own patients who have been suffering from 2 years and now they're pain-free. Then, ma'am, behind the heel is the retrocalcaneum bursitis, the strongest tendon we have. There also, ma'am, we give it. It being a natural product, ma'am, without any side effect, we get the best results. Regarding cost, ma'am, it varies from injury to injury, ma'am. The maximum cost which we charge for one injection is 28,000.
Indian rupees.
One injection.
Okay.
Wherever it may be in the body, that is for the maximum injury. If you
Including the prior visits and all that.
ma'am, we just require single visit, ma'am.
Okay. Okay.
You take
all
an
right.
appointment, come over. I'll keep the slot free for the prior appointee person, ma'am. We do it the same day and we free them.
Okay. Thanks.
So for one knee, ma'am, it is 28. Both knee, it is 56, ma'am. And then, ma'am, now how much it heals? Again, I said your body will tell. You will tell because your body is healing itself. If there is more damage, we need a booster dose that we may require at 6 weeks, 6 to 8 weeks.
Thank you.
Thank you, ma'am.
Thank you so much, sir. Sir, my next question is that viewers would like to know how is this GFC prepared and what is the process of injecting, how it gets done?
Yeah.
How is the whole procedure works?
Yeah, sir, there are different ways people are preparing, different vials people are using. How I prepare is like I use a 10 cc vial. I take out 10 cc blood for, I'm taking example of a knee joint, one knee joint. So I take 10 cc of blood in a vial, which we have. And then we allow this thing, platelets to get activated. And then we process it. And we separate those platelets and the growth factors. It usually takes 40-45 minutes for that. And then the separated growth factor concentrate, which I was saying, we call it a yellow golden blood. That is taken out from that vial. And the part where it has to be injected, that is clean, draped. We do everything in operation theater. And then we give local anesthesia to the skin from where the injection needle has to be pushed in. And then we push in the growth factor concentrate into the joint, put a band-aid, and ask patient that take bath after 24 hours so that the hole which is there, that heals by that time, and remove the band-aid after 24 hours. And especially for weight-bearing joints like knee, we ask them to take rest for 2-3 days, 3 days at least. One more thing prior to this is, we always ask patient, your results will depend upon that you should stop smoking few days prior to getting the procedure done. Drinking also few days prior to the procedure done and few days after the procedure. Same is with smoking and drinking, and same is with antiplatelet drugs. Like we take ecosprin or some painkiller, those should be avoided because they're antiplatelets. The quality and quantity of platelets and growth factors decreases if we have taken that.
Thank you so much.
Thank you, sir.
Dayal sir, you would like to take it from here?
Yeah, okay. Thank you, विशाल.
Yeah.
डॉक्टर जी, अभी मैं कुछ पूछूं आपसे.
Sure, sir. Sure, please.
पहले तो ये जो हॉस्पिटल स्टे है वो कितना दिन है? आफ्टर द
सर, hours, घंटों में कहूँगा सर, hours, 2 hours only.
बस?
Yes, sir.
In 2 hours you can be out.
Yeah, sir.
Amazing.
But you are mentioning that depending on the condition, you might have to inject something after 6 weeks or something like that, right?
It's a booster dose, sir.
Huh?
It's a
The
booster dose. Because, sir, like
Booster.
initially, if, vaguely I say you have 100% damage. A knee joint, we have 100. What damage we say 100. We are able to heal 50, 60% of it in first dose. Then we may require second booster dose.
So, it'd be quite inconvenient. Somebody from Hong Kong is coming, or Singapore, or Manila, or wherever.
Yeah,
So, he'll take one shot from you. Okay, he'll pay you or whatever. I mean, that's not important. But the question is, after 6 weeks, how do we solve the problem? He can't come again.
Sir,
And then,
next visit, we will give. Actually, we charge less for booster doses. For booster doses, instead of 28,000, we charge 11,000 only.
You mean, okay, as an
Also,
incentive?
you may not call it an incentive, sir. That is the policy of my hospital. I said it's
So
my
then,
passion. So
what are the
I just,
precautions after the treatment? What do we do after the treatment?
sir, one thing I just said before and after treatment, drinking, smoking, and taking antiplatelet drugs should be stopped for a week at least. 3 days, sir, you should give rest to your joint. For biological activities, yes, you can. You can walk down, have your food, go to washroom, and all that. Because, sir, something has been injected into your joint. It needs time to settle down. After 3 days, sir, then progressively we tell you start moving slowly, slowly, and by 2 weeks, like if you're doing 10 kilometers walking daily. So, first day you walk for half a kilometer. Fourth day, sorry. Fourth and fifth day, half kilometer. Sixth, seventh days, 1 kilometer. Eighth, 9 days, 1.5 kilometers. So that way, progressively you increase, and by 2 weeks, you are normal to what you were doing.
तो सवाल पैदा होता है कि suppose I come to Delhi and I
Yes,
take
sir.
your treatment. So how long
Sir.
I should stay in Delhi?
3 days, sir.
3 days.
वैसे तो सर it is not that also, like nowadays airports they provide you wheelchairs. The basic motto and the basic purpose is that you give rest to the part, whichever part is. Suppose it is frozen shoulder, no need, because we don't use it. You can just put a sling and go. Only thing is needed when it is a lower part, lower limbs in the body. So that particular area should be given rest for 3 days. So you can go in wheelchair and walk through. Little bit walking is also not prohibited. As though, sir, it is such a procedure. I inject this thing into your knee. You can come out and jog also. But problem is, basically, results would hamper. We were going to get 100% result. We may come down to 80%. There are no side effects if you walk or immediately you start doing something, but effect decreases.
So you have resolved problems of shoulder pain also? I
Yeah,
have
yeah.
few friends who have a lot of shoulder, left side, right side,
Yes,
and they have
sir.
to go for surgery, and now the
We
left side
do.
is weak. So
No, no,
it
sir,
can
we
be.
heal, sir. I have, you can give my Google page to people. They every patient put their own review whenever they want to and whatever they. So there are many of them who have been treated very well, and you can see the response from there. Even my YouTube channel is there, sir. It's all patients are
So,
giving it.
so YouTube channel is. Can you mention this on the show today, in case anybody
Uh,
wants your address?
Sir, I can
So
put it. I can put it on the WhatsApp group.
yeah, oh, no, you can't do that. Okay, I'll give it to. I'll share with them. Not a
Yes,
problem.
sir. Yes, sir.
But now the question is, you are mentioning something about autoimmune disease and regular traumatic diseases,
Yeah,
right?
yeah, yeah, yeah.
So your PRP solution or whatever you call it cannot address the problems of autoimmune. So can
Sir,
you talk about
autoimmune
this?
about the joints you're talking about.
Yeah,
Autoimmune diseases
autoimmune
which
could
involve
be
the
anything,
joints.
like ankylosing spondylitis to any other
No,
autoimmune diseases.
no, sir. That is something different. Actually, we are treating degenerative diseases like osteoarthritis or traumatic diseases like sprains, muscle injuries, ligament injuries. Yes, one of the autoimmune disease like rheumatoid, you have a particular joint which is involved. It will give relief, but it will not give relief up to the level it gives in a normal person. Sir, I've been treating a hemophilic adult. Hemophilia is deficiency of factor 8, where the blood bleeding doesn't stop. So he just came to me with severe knee pains. On humanitarian ground, I told him, this is what I do. If you want, I can go ahead with you. And I did it. And he is having very good results. So I told you, like, sir, I am doing things little beyond what normal people are doing. I little service also to the society. That patient, I don't charge anything. I do it free of cost for him. So it has been wonderful. His ankles have been very good. He told me, I could never imagine I'll walk in my life the way I'm walking now. So
So,
that kind of things, though effect is less because the disease which is suffering from keeps damaging it. But effect is surely there. Side effect is not there. But for ankylosing, sir, ankylosing is something very different. It
very
is known as
interesting.
bamboo spine. So it affects the ligaments of the spine. So there we don't do this, sir.
So only the joints, nothing to do with the ligaments.
Ligaments are traumatic injuries.
Ligaments are
Trauma,
what?
sir.
Trauma.
Traumatic injuries, sir. Yeah. Partial tears, sprains, that we do, sir.
That you can do.
Yeah, that is why, sir, we basically cover sports injuries.
So
These are the
ankylosing
commonest.
spondylitis, why you can't do?
So it's an autoimmune disorder. And in this, what I can't heal, there has been no damage. It is basically, that is why it is known as bamboo spine. It is basically converting your ligament into bony stiffness. So that autoimmune disorder basically stiffens your ligaments. So the first effect you have is it stiffens your spinal column. And it's an immune disorder, sir.
Now, I'm not very clear on the solution that you are making, PRP. What does it stand
Yes.
for? What does PRP stand for? Can you
Sir,
explain
it's
that?
platelet-rich plasma.
Say that
Platelet is a
again.
part, platelet-rich plasma. That is
Okay.
PRP.
Hmm.
So what
Okay.
one of the cells in the body which heals or has healing factors is platelet.
Hmm.
So in this, they are separated from your plasma, from your blood, and a concentrated form of those platelets is injected into the traumatic area, which is there. So those platelets, once they are there in a concentrated form, they get activated, and within them are the growth factors. Like the word says, growth factors which grow any injury in the body.
So the platelets grow in a concentrated form.
No, sir. The platelets get activated, they burst out. Growth factors are within the platelets.
In that serum that you're trying to make.
In that small cell, those multiple cells we have accumulated. It's like, sir, you have multiple pebbles in the room. You gather them all and put them in one corner. So what we do is we gather all these platelets and put them in a syringe, which is hardly 3 to 4 mm. So it's a highly concentrated form.
Are there many other surgeons practicing in other parts of the world?
Yeah, ma'am. Western world, it is very common, ma'am. You must have heard Tiger
Isn't it?
Woods, ma'am. When he
Tiger
got
Woods
it done
did
in,
that. Yeah, the
I
golf.
think 2009 or that was after that it became prominent, ma'am. He was one of the first athletes who got this done. Now,
Really?
as the study says, ma'am, more than 60,000 athletes are getting it done in America annually.
Really? We don't have anybody in Hong Kong, I don't think so.
Ma'am, actually, even I started this
Really?
sometime
So
back.
credit. So you are the pioneer of the whole thing.
One of the.
Very good. Congratulations.
Thank you so much, ma'am. And the moment I started it, I stopped surgery because then my mind doesn't tickle me towards surgery.
Yeah, better to
It's a very-
share your knowledge.
Yeah.
Very nice. Very nice.
Everybody
So
Lovely
I'll
to
wants
hear.
that.
continue.
Sir,
Uh,
please.
so PRP solution is you're taking 2 millimeters, right? I
No,
mean,
sir.
you extract.
No, sir. Out of 10 cc, we extract around 3.5 cc.
Okay. So
After,
in that case, what is the difference between
sir,
your
I'll
procedure and stem cell?
I'll just go back, sir, in a very
Okay.
local language. I'll tell you. पहले हमारी दादी नानी जो करती थी ना सर, कर्ड में से मक्खन निकालती थी
हाँ,
बिलो के.
correct.
I don't know if you've seen or not. So ये in a way वो लगा लीजिए कि हम ब्लड को बिलो के we take out the platelets. So हम उसका most important part ले लेते हैं. But sir, now I am doing GFCs, growth factor concentrates, directly. I am activating platelet outside only and taking out growth factors from them and injecting growth factors directly into the body.
So what is the, I mean, I'm still not clear between PRP and GFC. How do you,
Sir, PRP is you collect the platelets. It's a cell, sir. Take it like if 10 cc of blood has, example I'm quoting, 100 cells. Now, what we do is we collect those 100 into 10 means 1000 cells. We collect those 1000 cells into 2 cc or 3 cc. And that's a powerful this thing. And then we inject it. Like, sir, anything, even you may call anything which is aggregated becomes powerful. Like you put few sticks together, it is difficult to break them. They strengthen up. Same is for this. They strengthen up the healing. This was what we used to do. It used to be put inside your body and then they used to get activated. It will burst, sir. Ultimately, it will burst and then only it will release something. Now what we are doing is we are activating them outside the body. We are activating them. And they burst outside. They give growth factors. Those growth factors we are putting inside your body.
And nothing can get contaminated while
No,
you're
no,
doing.
not at all, ma'am. Not at all. I just said I healed a big infected wound with this. It's a very good natural healer. Our body is healing, ma'am. The best part of GFC is, sir, there is no pain, no soreness, nothing is there. In PRP, we used to have. Patient used to complain for pain for a day or two. And few people don't have much tolerance, so for them it used to be a bad pain.
Too much.
And
Yeah.
then we don't advise any analgesic because the moment we give analgesic, it is going to hamper the effect. So this is what we do.
what is your success ratio?
Sir, success is always there. Because I'll tell you, your body is healing your organs also. Everything in your body is being healed by them. They are your healing factors. They will give effect. But the basic thing depends how healthy your growth factors are according to your biological age, not chronological
Age and everything.
Then how much damage you have. Like I just said, if younger athlete, 20, 25, good physically, in them, there are many ones, sir. I think I'd sent one of a international shooter also who injured his knee while doing snowboarding. And he had multiple injuries in his knee joint and they all healed. After say 8 or 9 months, he could go and do 41 kilometer Tata Marathon in Bombay without any surgery.
So in that case, what about, do you have any testimonial from patients?
Yeah, I have multiple of them, sir. They are my
So
videos also.
can you show one video? Can you show
Sure,
us
sir.
one video and then you can talk about it later on after the video?
Sure, sir. I would like to show off the athlete.
Pradeep, please put on the video.
He's an international shooter, sir.
Yeah, I would like to show everyone the
Yeah.
testimonial, which will be more,
Yeah, more.
for all of us.
Deep Singh. I'm an international level sports person in shooting. I recently went to Gulmarg in Feb this year and I had a snowboarding incident where I tore my meniscus with a grade 3 tear and injury to almost all of my ligaments in my knee. And after that, I got a PRP injection from Dr. Sanjay Daya from Arihant Hospital. And after that, I resumed my physical activity along with my physical therapy, my exercises from the knee. After that, I started running as well, and I recently completed a 10K run, and now I'm preparing for the Mumbai Marathon. And you can see that I can run pretty well now, and my knee has been recovered.
Very
Well,
nice.
doctor, do you have the condition of the joint before he was cured? Is it
Yes,
possible
sir.
for you?
But I don't know how to send it, sir. I have it in my mobile actually. He's an athlete, so he was very concerned about his joint. So
Yeah.
obviously the moment he got injury, he got his MRI done from Chandigarh. He stays in Chandigarh. And one he got it done before he went to this marathon, 41 kilometer. So
Hmm.
there was, after that he sent me this, his opinion,
Positive.
his review. After that only he sent me his review. So I do have
So,
it in my mobile, sir, and it shows
so
healing
can
of
you send me
majority of the
a
injury.
WhatsApp?
Yeah, I'll surely, sir. I'll just find it out and send it to you, sir. I have to go through his WhatsApp, and I'll surely send
And
it to you.
I have one sensitive question. Now,
Yeah, yes, sir.
obviously, it is conducive for everybody to visit your place. But suppose two or three people in Hong Kong or anywhere else get together,
I was going to ask that question also.
would you be
Yeah.
able to come? I mean, if they would sponsor your visit, instead of three people coming to you, they could all coordinate and call you and pay for all your charges, hotels. How long would it take? I mean, if you were willing to do that, uh,
Sir,
how
I
long
don't
would you?
mind. Yeah, I don't mind doing it, but I have to see, sir, whether I can get my machines there. That is something I would like to,
Oh.
because without them, I can't do anything. My
So,
equipment.
have you ever done that before?
In India, yes, I've moved to a place, not outside India, sir. People do come, like somebody got it, a German physiotherapist got it done from me. Then she sent some other person. So this way, people are coming, but what all they do is, sir, I'll tell you, they make the trip. They come to Agra, Jaipur, and they get their GFC done from me, and they move back. So they
Ah.
make it a tourist kind of a trip. Like they can visit
Okay, so
India
in that
also.
case, we can come for Ayodhya and come and visit you also.
Yeah, yeah,
Now,
yeah, yeah.
the whole world would like to visit Ayodhya. So probably we can mix the two of
Yeah,
uh,
yeah.
as to one for the spiritual
That I,
life and one for your physical
Yeah.
life. We can mix these two and have a successful trip to you.
yeah, yeah.
I
It can
think
be a
so.
spiritual as well as medical trip,
Material,
sir.
yeah.
And let me tell you, sir, one thing, my own experience. There are nothing, no researches on this to document, but I feel the more positive you are, the more happy you are, the
Of
more
course.
spiritual you are, your cells which heal your body, they are equally strong. And your zeal to heal yourself is equally strong. And I've seen very good results in those people. I always tell my patients, have faith in me, have faith in my hospital, and then come to me, because that feeling itself will give me very good growth factors from your body.
Faith is very important. Faith is very
Yeah,
important.
yeah,
So, do you think that mantra and meditation helps to heal?
yeah.
Have you?
Why not,
Of
sir?
course.
Yes, yes, of course, of course.
It has helped, right?
Yeah, yeah. It is wonderful way. I put it in physiotherapy. People say heating and this and that. No, your physiotherapy starts from your mind. You have to
Hmm.
heal your mind first. Then it's physical healing. It's physical and spiritual both.
True. Good. I think I've finished most of my questions. If Vishal has any question or Meenu has any question, please go ahead and ask.
No, earlier you said about the exercises that you look at the patient and then give
Yeah.
exercises because some may be good. So how does one know who's telling you the right exercises? I mean, like I've been to several orthopedic surgeons in London, in Hong Kong. I've seen three. I've gone to physiotherapists in different places. Each one gives a different series of exercises, and some give you pain, some don't. So how to know what is good, what's not good? Each one is
Ma'am,
different.
like I said, the faith the patient should have in doctor. I equally appreciate my patients. I see with them
Sorry?
zeal. Like I said, the patient should have faith on doctor. I equally, whenever a patient enters my clinic, my mind, the only one thing which goes in my mind, somehow I have to cure this patient. So my angle of looking towards the patient is very different,
Positive, very positive
very
also.
positive and more. See, like ma'am, everywhere commercial angles have come. So my treatment is first, rest everything is second. So that is what makes you get more involved, think more deeply. When you have a passion for the when you have when you have compassion for the patient, you feel
Of
like
course.
it's your pain. So that is emotional connect with the patient.
Very good.
Like sir
Lovely.
said now, what chanting and what mantras would do. So I'm saying the same thing even in us also. The more we get connected with the patient, the more we think about the pain, the trauma, the problems patient is facing through, the better we are able to think about it, the better we are able to find the solution for that, ma'am.
So
And
you're not
somehow, madam,
commercial. You're not commercial at all, like we have in many other places, right?
ma'am, I would not say I'm not commercial at all because the clinic I'm sitting is obviously, my owner says, my monthly expenditure is so much, and you get everybody to me, कि sir इसका concession कर दो, उसका concession कर दो. But still, I feel I always listen to my heart before doing anything. I connect my heart, then I connect my mind, and then I think. But that's my approach. It has been my life's philosophy.
Very good approach. Thank you.
So,
Thank you.
doctor,
Thank you so
if
much.
somebody wants to know, uh, you can be contacted on Google just by typing your name.
Yes, sir.
So,
Dr.
Dr.
Sanjay
Sanjay
Dahiya.
Dahiya,
Yeah,
and
Dr.
your
Sanjay
address,
Dahiya.
they can find out your address in Delhi on
Sir,
Google.
it's NCR, sir. From the airport, it is 20-25 minutes.
Okay. I
It's in
understand you treated
Gurugram.
my sister also
Yes,
and
sir.
my brother also. So,
Yes, sir.
so how's she doing?
Good, sir. Brother is very good. He's quite happy. And
Okay.
exciting 5 weeks. He
Yeah,
was in
she
Agni.
very highly of you. I
No, no,
also
sir.
invited her
It's,
on the show, but
sir,
she's
Oh,
their,
shy.
bless, their blessings were needed more. So like I said, na, there's emotional connect. Like I needed their blessings to be there for me.
Okay, fantastic. So then we look forward to see you.
Sure, sir.
Probably you should consider if you can get your machines to Hong Kong, then maybe you can round up two or three patients if they're interested. We'll see.
machines would be
Just a thought.
difficult, of course.
Just a thought.
That's I would have surely some. I would have loved to be there, but I don't know about the customs
Okay.
and all that, sir.
Matter of studying, we can study that
Yeah,
as we
yeah,
Yeah,
go
yeah.
along.
sure, sir. Sure, sir.
Thank you.
And now, Vishal, how would you like
Yeah.
to? You have any questions? Lasting
No,
question? You
I think almost he has answered, Dr. Sir has answered every question we asked, and viewers must be more, clear on the subject, which was, and thank you, Daduzen, for identifying and always curating such good content for the show, and this will really help many people, thousands of people across the globe to at least change their mindset, because mindset is major thing. Someone comes and speaks with so much of conviction, the mindset
Exactly.
Hmm.
completely changes. People start believing and accepting to the new ideas. Otherwise, operation has become so common. Everybody wants to just jump in and get it operated, and they think that
Yeah.
okay, we are okay now. So this is a good angle which we saw today. Thank you so much, Doctor Sir. Yeah.
Surgery
Thank you,
is
sir.
always the last part. It's like
Yeah.
going to war. So before
Yeah.
that, try to see if we can have non-invasive approach.
Yeah.
Please.
Better always. Yeah.
Okay. So I believe in that, and I think Dr. Sanjay is using that non-invasive approach, and
Yes.
that makes a lot of difference in healing.
My owner is an athlete, sir. I
Pardon?
didn't connect him. My hospital owner is himself an athlete. He runs 15-20 kilometers daily and very physically fit person. He just got his knee joints done by me 4-5 days back.
Hmm. Hmm. Okay.
He felt like he started having pain and he got it done. I have his video also with me.
I see. But now there is no time to show
Yeah, I
another video,
understand,
right?
sir. I very well
But can
understand.
you mention any other testimonial of your any one client?
Yeah, sir. We have. I'll send it to you, sir, on the group also. I have many of them, sir.
I
I'll
saw
give
it
you my
on
sites
Google
also.
also.
Yeah, ma'am.
Yeah.
So we can watch all your testimonials on
Yeah,
Google.
sir. Sir, sure, sir.
ठीक है. So it was nice having you with us. We are very gratified, and I'm sure all those people who have listened must have had a ray of hope for living a pain-free life with your introduction and with your new or innovative. For how long has this been around? This PRP, is it an old thing, new thing?
Sir, in Western world, yes, it was. I said like Tiger Woods 2007 or 9. I don't exactly remember the year it started. And from there it started picking up, sir. And initially it was not covered by any insurance company in America also. Then it
Now,
started.
is it covered now?
Ma'am, they started covering the army people then. And now they say one or two of them companies are covering. It is not in my knowledge, but I've heard one or two have
Okay.
started covering it there.
But
So
India is not.
no,
India,
sir.
nobody is accepting.
So India is a very new concept. It will take a little time.
Yeah. But
So you think
Westerners
that
are commonly using it.
Yeah, ma'am.
people are getting used to this idea, this new idea? Yeah.
Yes, sir. It does take time to change the mindset of people. But yes, nobody wants to get operation also. Nobody wants to get operated. It's a major operation, sir. And when something can be healed without operation, why not going for it?
Of
Because,
course.
see, sir, anything where you pick up knife, it has what pros and cons.
True.
Okay, very good. Thanks so much to you and to Minu also, the Minu, for
I'll tell
coming
you
on.
one quick thing. So I was in London, and my orthopedic surgeon told me, who was a lovely man, but for me, surgery was the only solution. So I have gone to the hospital, Princess Grace Hospital. I have worn the uniform of the hospital, cap, everything ready to go to the theater. And for some reason or the other, they did my UTI test, and I had an infection. So everything was stopped, and they said, we cannot do surgery while you have this infection. So I was spared, let's put it that way. I was spared in a way, God's will again. So now let's see what next.
Perhaps you had to meet Dr. Sanjay and take his
Absolutely.
offer.
Always for a reason, always
Maybe
for a
this is
reason.
in your destiny, who knows?
Thank you. Yes, we'll definitely do our best.
So it's time to end our show. Vishal, would you like to end it with
Yeah,
a prayer?
sure.
And thanks to everyone.
Yeah. Thank you. So today, thank you everyone again. And today, the best part of the show was, of course, the technical things were very nice. But Dr. Saab, I'd like to appreciate that you put that spiritual angle to the treatment, which I like the most. You
Very much.
said that so the patient always comes with the thought that I want to get cured to a doctor. This is the thought process of every patient across the world, irrespective of which doctor he goes. But the angle which you said today, I have set in mind that I want to cure that patient and I will be able to cure that patient. That attitude and thought process really is commendable, and salute to you
Very
for this thought process. Really, I liked it very much.
excellent.
So Lord Dhanvantri is known for she's known for God as God of Ayurveda. So I will just finish this, end this show with this slok of Lord Dhanvantri. So it says, Om Namo Bhagavate Vasudevaya Dhanvantraya Amrita Kalasha Hastaya Sarva Maya Vinashaya Triloka Nathaya Shri Maha Vishnavi Namaha. This was the Dhanvantri mantra, and it is used for healing processes, and people chant this mantra and they get healed faster. Thank you.
Why don't you
Thank you.
share that with me also?
Yes,
Yeah,
I
Thank
will.
you, Dr.
This
G.
mantra is very, very powerful. Yeah.
Thank you.
Okay, Dr. G, thank you once again. We'll
Thank
be
you
in
so much,
touch on
sir.
the WhatsApp. And the Meenu,
Sure,
thank you for
sir.
coming.
Thank
And
you.
it
Thank
was
you,
a
Thank you
pleasure
Dr.
all.
to
Zen.
meet you.
Thank you all.
And
God bless
we'll
us
see
all.
you. We'll talk to
Thank
you
you very
again.
much. Thank you, our
God
viewers.
bless.
Yeah, thanks.
God bless us.
Thank you.
Hari
Thank you, sir.
Om.